Hi everyone, this is me Abisha. Welcome back to my channel. Today let's discuss about what materials we can use in step 2. I've been getting a lot of comments regarding step 2 materials and I really wanted to make a video, so I'm here with my laptop so that I don't miss anything. For step 2, let's begin. Step 2 is not like step 1. It has many resources, and with step 1 there were limited resources, and if you read the resources like first aid, UWorld, you would definitely pass step 1. But it's not like that in step 2. I won't say that step 2 is very difficult, but it's definitely a lot to take in because there is a lot of information out there and many guidelines, they get updated at times, so it's a lot to take in. Some people prefer some resources while the other prefer different resources, so it definitely varies upon person to person and their preferences as well. But today I'm gonna discuss you about the resources that I personally used and I personally liked. Until now also the resources that I used is really helpful even in residency as well, so I believe that these resources can really help you get a good score in step 2 and also build your knowledge. So let's begin. Number 1 resource is hands down UWorld. There will be different opinions though. Some people prefer different other question banks, but for me personally, UWorld is the best for step 2. It covers most of the chapters, most of the high yield questions, and the way the UWorld is set up, the questionnaire, the options, it's very much similar to the real exam. Don't treat UWorld as a question bank just to test your knowledge. Treat it as a separate resource because it is definitely very high yield for step 2. And what you can do is that when you encounter a question in UWorld, suppose for example you have a question regarding pericarditis, okay, and you don't understand certain thing in UWorld, what you can do at that time is use another resource that I'm going to talk about. It's called Ambus. Suppose you want to read about pericarditis, just type in pericarditis in Ambus and there will be a set of things that you need to know, from the diagnosis, the treatment, clinical features, everything in details in the Ambus, and it is way easier to learn that way. You can also do the question bank in Ambus as well, but I would consider UWorld question bank as a priority and then Ambus question bank as an alternative if you have time or you want to explore certain other questions, so you can do the Ambus thing as well. But first is UWorld. If you do not understand the question from UWorld, you can definitely search it up on Ambus and also use the question bank in Ambus for alternative questions. Okay, so till now we talked about UWorld, doing UWorld, and if you don't understand a thing in UWorld, certain topics in UWorld, you can always view Ambus. So these are the two things that can go side by side. Now the other thing that you can use to gain more knowledge on certain topics or also view detailed management of certain diseases, certain diagnostic things which are generally not very clear in UWorld, that can be viewed from UpToDate. Okay, sometimes UpToDate can be very overwhelming for you when you start, but as you get the hang of it, there are some charts, some tables that will be really helpful in step 2 because step 2 is mostly about diagnosis. So in UpToDate there are certain charts that will be really helpful because they will show you step by step what to do for the diagnosis of certain diseases. So it can be really helpful. At times UpToDate can be overwhelming because there are a whole lot of information out there, but you need to filter what's needed for you at your level. And for brief learning you can always view Ambus, and if you want to go into depth you can always use UpToDate. So your main resource will be UWorld, and to further gain knowledge about certain topics you can always use UpToDate or Ambus side by side simultaneously. Okay, so other thing that you have to do in step 2 is that you get a lot of questions regarding the screenings, the vaccination. For the screening you can visit the USPSA USPSTF website, and you can see the screening for colon cancer, for the breast cancer, HIV, depression, anything that pops up in your mind you can view in that particular website, so that you get updated form of the screening, because it is very high yield in step 2, the screening. And what you can do is learn the vaccination schedule from the CDC guideline itself, because you get a lot of vaccination questions, the screening questions, so you need to be really up to date on that. For step 2, the guidelines for screening and vaccination is also really important. So till now you have the main resource for your study, which is UWorld, along with Ambus and UpToDate simultaneously, and you are up to date with the vaccination schedule and screening schedule from the USPSTF and CDC. But what you have to do is you need to have your own note. You can use Anki, or you can also have your own note, but you need to be really efficient with the note taking, because step 2 is a lot. I already said it, I'll say it again and again. There are a lot of information for step 2, so you really need to be particular with the notes, so that during your last days of preparation you won't be overwhelmed with all of the information that you have. So you need to keep notes. However you take, whatever you take, I don't care, but whatever is effective with you. For me personally, I used to do handwritten notes, but whatever is comfortable with you, whatever works for you, do take notes. Please do take notes. I want to give you one tip for note taking, because step 2 is all about differentials. You need to differentiate between various diseases that look similar, that are presented similarly. So what you can do is make your note in such a way that you can really differentiate between the diseases. What I used to do during step 2 preparation is that, suppose a patient has septic arthritis, okay, it presents with arthritis symptoms, but there are a lot of arthritis such as reactive arthritis, septic arthritis. So there are a bunch of arthritis that needs to be ruled out within the presentation. So what I used to do that is make a table for those, right, differences between the arthritis, so that later on when the question pops up in my UWorld, I'll be like, oh, the septic arthritis needs to have this, but reactive arthritis doesn't have this. So while you do note taking, combine the similar kind of diseases and make points to help differentiate between those diseases. How will you differentiate between those diseases that look similar, that comes in a similar pattern in the exams? If you make notes like that, it will be way easier for you during step 2. Honestly, there are lots of diseases that will present similarly, so it will be really helpful. So for biostat, I always prefer Randy Neal. Honestly, I'm not good with biostatistic. Whatever I learn from Randy Neal videos on YouTube. And in step 2, you won't get a lot of biostats, so you don't have to worry about it. The main part is diagnosis in step 2 and all the screenings and the guidelines for vaccination. There are a bunch of resources. You need to choose what to study, and also you can definitely go back and read first aid. I definitely use it for step 1, step 2, step 3, everything. Okay, after you gain knowledge, you want to test it out. So what you can do is you can do NBMEs. I personally prefer UWSA, but it's a personal preference. It's just to test your knowledge. Even if you score less, you don't have to worry about it. You just keep tracking your NBME scores, and then you'll definitely be better the next time. It's definitely helpful if you do the Amboss questions time and again, and if you do NBMEs, if you do UWSA, because it provokes your mind to think in a different way other than UWorld, because you will be studying UWorld for a longer time. So the change in the questions will be very helpful to you. So you can do that in alternative days. But if you ask me, the main resource will always be UWorld, hands down. So these are the main resources that I prefer, but there are other resources as well that you can look for. There is Divine Intervention podcast that people actually love. So these are my recommendations for step 2 resources. Before ending my video, if you are going to take step 2, do not worry, just relax, because I know that there is whole bunch of information, whole lot of knowledge for you to gain in step 2, and It might feel overwhelming, but you'll do great. And just stick with your plan, stick with few resources rather than just going through everything. Fill in the gaps of your knowledge using other resources, it's okay, but you just stick around with few resources only so that you don't get overwhelmed and you have the knowledge. Second thing is always test your knowledge, see where you are in terms of knowledge, take tests often. And the other thing is make notes. Please make notes, guys. It will be really helpful. Take short notes, not the lengthier ones like differential notes, but please make notes. It will be really helpful. And the fourth thing is just relax. Again, relax, chill, take your time. As an IMG, I know you'll have a lot of pressure to perform well in step 2, but it will be great. You will do great. You guys will match. So all the best from my side. If you have any questions, just drop in the comment section below and I'll be more than happy to help you out, guys. So see you in my next video. Bye bye.